Hello, I'm Dr. Larry Hanus. I'm a general dentist practicing in Iowa City, Iowa. Our practice emphasizes holistic biological and alternative dentistry, which means we take into consideration not only your oral health, but its relationship to your overall health as well. In this PowerPoint, we'll be talking about periodontal or gum disease, a disorder which affects the majority of American adults. If after viewing this video it piques your interest, we'd like you to visit our website, iowamercuryfreedentistry.com. That's iowamercuryfreedentistry.com for more information. I hope you enjoy our natural alternative approaches to treating periodontal disease. Thank you. This is Dr. Larry Hanus. I'm a general dentist in Iowa City, Iowa, emphasizing natural alternative holistic approaches to dentistry. I'd like to welcome you to our website, iowamercuryfreedentistry.com, and our PowerPoint on periodontal or gum disease. The Department of Health and Human Services report states that most adults show signs of periodontal or gum disease. And most of these adults aren't aware of having periodontal disease, whether they go to the dentist regularly or not. What does periodontal mean? Well, perio means around or the perimeter of the tooth, and dontal simply refers to dental. Your gums form a cuff or collar around the neck of your tooth to protect the periodontal ligament, which attaches your tooth to the bone. When their gums are healthy, the collar or cuff is healthy, your ligament is protected from infection. And health of the gums is determined by placing a small ruler or probe beneath the cuff or collar of the gums. In this case, you see the probe is calibrated in silver and black bands of 3 millimeter increments. The farther it goes, the more the periodontal problem. Periodontal disease is an infection of the gums, the ligament, and the bone around the tooth. The depth the probe goes below the collar indicates the severity. Generally, if the probe goes over 4 millimeters into the collar or into the black on the probe and there's bleeding present, that tells us there's early gum disease. And at 5 millimeters or more, we usually have irreversible damage to the bone holding your tooth. Common symptoms may be swollen red gums, bleeding during brushing. However, you may have periodontal disease and they may not bleed during brushing if you don't effectively place the brush bristles into the same places where the periodontal probe was placed to diagnose the infection. You may have persistent bad breath, bad taste, pus between your teeth and gums, loss of bone holding the teeth, gums tender when they're touched, and you may have gum recession, or you may have an appearance of being long in the tooth, which is often associated with clenching or grinding of the teeth. Common cause of periodontal disease is bacteria located in the sticky plaque, the substance forming on your teeth when you don't effectively clean. And to eliminate that bacteria, the immune system releases substances that inflame and damage the gums, which causes the swelling and bleeding. Other factors affecting periodontal disease are stress, which is implicated in almost every disease, which weakens the immune system, poor nutrition, which doesn't support a healthy immune system, clenching and grinding of the teeth, which increases the breakdown of the ligament and bone, and clenching or grinding of teeth, also known as bruxism, is often associated with stress. Toxic metals in dentistry, including mercury and nickel, can cause inflammation in the gums. Diabetes increases the infection risk, and there is a link between diabetes and periodontal disease. Fluctuating hormones as in pregnancy can contribute to the inflammation, and medications which cause dry mouth can cause an increase in periodontal infection. Diagnosis again is accomplished by placing a probe, which is a small ruler between the teeth and the gums. You see the black and gray bands. The bleeding, it's important to note, is not caused by the probe. The bleeding is actually caused by just touching the ulceration in the gums. It's similar to if you have a skin ulceration or swelling or scab and you poke at it with your finger, it can cause it to bleed. In this situation, just touching the gums with a probe will result in the bleeding, and x-rays may be used to demonstrate loss of the bone. Systemic relationships between periodontal disease and other conditions may exist in heart disease, stroke, diabetes, premature births, respiratory disease, chronic kidney disease, obesity, osteoporosis, rheumatoid arthritis, and some forms of cancer. Diagnosis of periodontal disease, again, is accomplished by probing. On the left, you see the red puffy infected gums indicated by the arrow. You see the red collar with the yellowish plaque, and on the right, you see the probe gently placed under the gums results in bleeding. Another diagnostic photo. On the left, you see two metal crowns together, the swelling gums between. On the right, you see the probe gently inserted results in the bleeding. Natural alternative holistic healing methods. These are highly effective, and they can consist of individualized specific home care hygiene programs which have to be meticulously implemented, which can include specifically tailored brushing, flossing regimens. It consists of nutritional enhancement to get antioxidants, minerals, and other nutrients. It can include stress management and limited advanced clinical therapy such as deep cleaning with anesthetic, and rarely it may require minor surgical procedures to correct it. Here's an example of a natural alternative healing. On the left you see before photo with the plaque, the bleeding, the swelling, and on the right you see 1 week later after the implementation of the alternative healing methods. You see the bleeding, the plaque, the swelling, and the periodontal disease gone. Another situation, all these 4 photos from the same person. On the upper left you see the before, on the upper right you see the probe inserted with the bleeding from the swelling present. The lower left is when the home care program is instituted. You see dental floss applied and the excessive bleeding present, and on the right you see 1 week later, no bleeding, no swelling, no periodontal disease, just basic holistic procedures applied. I would like to thank you for viewing our PowerPoint. This is Larry Hanus. Please visit our website again anytime, iowamercuryfreedentistry.com. If you'd like to call our office to make an appointment or for more information, please feel free to do so. Phone number is 319-512-5655. Again, 319-512-5655.